Welcome to Amazing World Facts. Today we're diving into the topic of a health concern that's making headlines around the globe, MPox, a virus formerly known as monkeypox. This deadly cousin of smallpox was virtually unknown until 1958, but has since emerged as a serious global health emergency. Let's explore what MPox is, how it spreads, and why experts are increasingly worried about recent outbreaks. MPox is rapidly spreading across Central Africa, including countries where it has never been seen before. World Health Organization Committee Chair Dimiye Ogoina states, the current upsurge of MPox in parts of Africa, along with the spread of a new sexually transmissible strain of the monkeypox virus, is an emergency, not only for Africa, but for the entire globe. He warns that MPox was neglected in Africa and later caused a global outbreak in 2022. Now, with the highest recorded cases in the Democratic Republic of the Congo and its spread to neighboring countries like Burundi, Kenya, Rwanda, and Uganda, the WHO has declared a public health emergency of international concern. So what exactly is MPox? MPox, a member of the orthopox virus family, is less severe and less contagious than smallpox, but still poses significant risks. It causes symptoms such as a painful rash, swollen lymph nodes, and fever. According to virologist Bernard Moss, MPox has two genetic clades or varieties. Clade 1, currently causing the outbreak with a mortality rate of about 10%. Clade 2, responsible for the 2022 outbreaks and is less deadly, with a mortality rate of under 1%. A new version called Clade B is emerging, raising concerns due to its potentially higher severity or transmissibility. Children are particularly vulnerable, as seen in the Democratic Republic of the Congo, where many cases involve those under 15 years old. MPox is a zoonotic disease, meaning it is transmitted from animals to humans. It was first discovered in 1958 among monkeys in a Danish research lab, but small mammals in African rainforests likely harbor the virus. Interestingly, the exact reservoirs of MPox remain unknown, despite only being isolated twice in wild animals. In 1970, the first human case was reported in an infant boy in the Democratic Republic of the Congo, with most infections since occurring in West and Central Africa. MPox spreads in several ways: direct contact with infected animals or contaminated items such as clothing, bedding, and towels, close contact between people, including through kissing, talking, and touching infectious skin or lesions. Epidemiologist Andrea McCollum describes the lesions as little viral factories, highlighting the need for caution. The incubation period ranges from 3 to 17 days, and individuals are contagious until their rash fully heals and a fresh layer of skin forms. The 2022 outbreak notably affected men who have sex with men, complicating public health education efforts without stigmatizing communities. According to David Heyman of the WHO, large gatherings like raves in Spain and Belgium likely amplified the spread, much like early COVID-19 events. However, MPox isn't classified as an STD. Bernard Moss explains that MPox spreads through skin-to-skin contact, including sexual activities, and through contaminated items like bedsheets and towels. Anne Ramon, an epidemiologist, emphasizes that MPox doesn't discriminate based on gender or population. There are no guardrails, she warns. This virus is not necessarily going to stay within one gender or one population. Fortunately, there are tests available for MPox, which involve swabbing a lesion to confirm the diagnosis. The CDC recommends testing if you have a rash similar to MPox. As for vaccines, 2 are currently recommended by the WHO. The U.S. Department of Health and Human Services urges high-risk individuals to get vaccinated, especially with the 2-dose Jynneos vaccine. While the good news is that those fully vaccinated or previously infected with Clade 2 MPox are likely protected against severe illness from Clade 1, there's a downside. Vaccines aren't widely available in the African countries most vulnerable to outbreaks. The WHO's emergency declaration allows the agency to recommend how member countries should address the epidemic, mobilizing funding and support. Public education and awareness are crucial. As Rosamund Lewis of the WHO states, we don't want people to worry, but awareness is what you need to protect yourself. By staying informed and vigilant, we can help prevent the spread of MPox and protect our global community. Thanks for watching this episode of Amazing World Facts. If you found this video informative, don't forget to like, share, and subscribe. Stay curious and stay safe.